All right. So we're starting again with the chest, and I'm going to ask my patient to go ahead and remove his gown so I can inspect the chest area. Looks normal, even distribution with the hair here. No deformities noted. I'm going to go ahead and listen to his heart sounds first. We obviously are going to identify the S1 and S2, making sure there's no extra beats in here, no S3, no gallops. And we're going to listen at the apical for 1 full minute. I gotta get my stopwatch on. So 1 full minute at the apical. You hungry? Alright, so that's our full minute. Listen to the apical pulse there. We're going to listen to breath sounds. Always going from one side to the other to make sure it's equal. Take a breath for me. Let out. Another breath. So breath sounds are equal. We're going to go to the back and do the same symmetrical movement there. Take a breath for me. Good. 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 So breath sounds are equal in all fields. They're clear in all fields. Again, he has no problem breathing, no wheezing noted, anything like that. Gonna look at your arms here. Go ahead and extend them out. And we're looking for symmetry, number 1. Put your lights on. We're looking for symmetry as well as any lesions, rashes, moles, anything that's new that would concern him. We're going to feel for the radial pulse on each side. Both are good, normal. And then also the brachial pulse on each side. Both is good and normal. Warm to touch, all the way down. Hands look good. No clubbing of the nail beds. Cap refill is great. Less than 3 seconds, so all that looks good. Good. Alrighty. Go ahead and put your shirt back on. I'm going to ask you to go ahead and lay back for me. We're going to be looking at your belly. So again, just providing some privacy, laying him back to his own comfort level. Going to lift up the gown here to inspect the abdominal area. And again, you're just looking for symmetry, making sure there's no distension, no bulging, no hernias. The umbilicus there looks good. It's inverted like it should be. So just looking. Going to listen to bowel sounds in all 4 quadrants. Okay, so you got positive bowel sounds, and then we're going to palpate. Again, you're palpating. If there's any tenderness, any pain, you're going to palpate over here where the liver is at. If there's any rebound tenderness, as well as the splenic area. There's no grimacing by the patient. He doesn't moan, he doesn't guard, and he doesn't complain of any pain. We'll cover that. I'm going to go ahead and expose the legs here because we will be looking at the legs at this point, as well as the inguinal area. We're checking for a femoral pulse, and the left side is good, so we'll check it's good as well. Lift these shorts up. For the legs here, just skip this second. The legs are equal in length. Hair distribution is good. Warmth is good. Pulses, pedal pulses here. Pedal pulse over in the right leg as well. Post-tibial pulse, you want to feel that in both sides. Got that. And as well as in the left leg. Noting there is a little varicose vein here in the patient's leg. Nothing that looks very torturous, but it is noted and is in his documentation as well. Looking at his feet, looking good. And between the toes, the webs of the feet looks good. Skin's intact. Toenails look good. He takes care of them. And calf refill again is less than 3 seconds. No tibial edema is noted. Just go ahead and lift up and back, inward and outward. Very good. Right now I'm going to ask you to bend your leg, or stretch it up. Good. And you're checking to make sure that the hip is able to support that, so that is good. Bend it, and then out, and then in. Do you have any pain with that?
No.
Good. Relax. And then with the other leg again, lift it up. Very good. Bend it. Inwards and outwards and down. Very good. At this point, while the patient's still laying down, we can go ahead and do the sensation. I do have a little cotton applicator here as well as a needle. And I'm going to let the patient feel that so he knows. Go ahead and put your arms down by your side for me. This feels soft. This is the cotton. Okay, I want you to be able to identify that as opposed to this, which is a needle. Can you tell the difference?
Yes.
Okay, which one is this?
Soft.
And which one is this?
Needle.
Alright, we're going to check his face, arms, hands, legs, and feet. Close your eyes.
Soft.
Good.
Sharp.
Good.
Sharp.
Very nice.
Soft.
Good.
Soft.
Uh-huh.
Sharp.
Good.
Soft.
Uh-huh.
Soft.
It is.
Sharp. Sharp.
Good. Alright, so all that was correct. He did go with that. And I'm going to ask you to go ahead and sit up for me, sir. Go ahead and dangle your legs over the side for me. And what I'm going to do is ask you to do some repetitive movement here. When you go 1, 2, 3, 1, 2, 3. Good. Just like a little chant here. Very good. If you can go ahead and stand up for me real quick. I'm going to ask you to turn around. Again, inspecting the back here. I'm going to get you to bend down. We're looking over here at the spine. And really what you want to make sure that there's normal curvature. There's no lateral curvature of the spine, but also normal curvature, kyphosis for his age. And it looks good. He's not had any problems with that. And sit down. At this point in the examination, I just want to tell my patient thank you for their, for the time, and just encourage, since there was some sunspots noted, that he does use sunscreen while there's skin exposure out there. The little varicose vein here, just keep an eye on it if he's on his feet long term during the day. Just try to use some support stockings as well. The back pain, it sounds like it's muscular he's had. Definitely continue what he's doing at home if it is working. And if the pain increases or isn't getting better, to follow up with his family physician. So that ends our physical assessment, and I appreciate your time. Thank you.